Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mrs. Sima. May I know what brings you here today? Okay. Right. Congratulations, Mrs. Sima, for having a baby girl. What do you know about contraception? All right. And for how long you need contraception, Mrs. Sima? All right. Well, Miss Sima, we have many options like pills, injections, implants, coils, and devices and condoms. So, what you are interested in? Okay. All right, Mrs. Sima. So before I explain something about pills, in order to find your suitability for pills, I would like to ask some questions. Okay, but let me reassure you, Mrs. Sima, that all conversation will remain confidential between you and me. Okay, and nobody else will ever know about it. Okay. Yes, Ms. Sima, purpose is find out suitability of pills, whether pills are suitable for you or not, if it makes sense to you, Mrs. Sima. All right, Mrs. Sima, thanks for your cooperation. And so, since how long you are married? All right, okay. Okay, and are you using any form of contraception? Okay. Okay, and if it was your first child? All right, Mrs. Sima. So either you or your partner have ever been diagnosed or investigated for any discharge from front passage? All right. Have you or your partner ever had a sexually transmitted disease like chlamydia, gonorrhea, syphilis, HIV? Okay. Right, Mrs. Sima. So, can you tell me when did you had your first period? At what age? Okay, at 14. Okay. And when did you had your last period? 4 weeks ago. Okay. Okay. Can you tell me any bleeding in between periods, if there is any history? Okay. If they are regular? Okay. How many days? Cycle? 20 years. Okay. All right. It lasts for 3 to 4 days. Okay. What about flow, Mrs. Sima? Okay. Okay. And how many pads do you have to use every day? Okay. Okay. So, Mrs. Sima, how many times you have conceived so far? 2 times. Okay. And how many live children? Okay. But I have to ask Mrs. Sima if any mishap like miscarriage or abortion happened. Okay, and what was mode of delivery? Okay, are you currently breastfeeding? No. Okay, is there any chance that you could be pregnant again? Okay. If any problem occurred during pregnancy? Any complication during labor and delivery? After birth? All right, Mrs. Sima. So I need to ask you a few more questions, okay? If it makes sense to you, Mrs. Sima. All right, Mrs. Sima. So may I know your age? Okay. Okay, 28. Okay, Mrs. Sima. Do you smoke? All right. Okay. And you stated you are not breastfeeding. Okay. And do you have high blood pressure? High blood sugar? Do you know about your weight or your BMI? Okay. If there is any history of headache? And if you are suffering from any migraine? Okay. Leg swelling? Okay. Okay, if there was any history of DVT during pregnancy, okay, and any liver disease. Okay, all right, Mrs. Hima, if you're taking any sort of antibiotic or any medicine for fits. All right. Okay. Thanks for your cooperation, Mrs. Hima. So, yes, combined oral contraceptive pills are suitable for you, okay? And this contains two hormones, okay, estrogen and progesterone, which are similar to what a body produces, okay? Yes, Mrs. Hima, it works by changing the body's hormone balance so that you don't release an egg from ovary, okay? And it also makes it difficult for a sperm to enter womb, okay, if it makes sense to you. Yes, and also making it difficult for fertilized egg to attach to uterus lining, okay? Yes, Mrs. Hima. So method of taking pills is, it effects start immediately, okay? And if it started on the first two, of 5 days of cycle, okay? And if it's starting at another point in cycle, then I'll advise you to use additional contraception for first 7 days of use, okay? Take one pill once a day for 21 days. Okay, then a break for 7 days for withdrawal bleeding. If it makes sense to you, Mrs. Seema. Yes, Miss Seema, you not to be worried. I'm here to explain everything to you, okay? So that you don't come back and worry, okay? Yes, Mrs. Seema. So if any pill is missed, like if one pill is missed for more than 24 hours, okay? Anywhere in the pack, okay, take missed pill as soon as possible, even if it means taking 2 pills in 1 day, okay, and continue take rest of the pack as usual if it makes sense to you. Yes, and no additional contraception is needed, okay. If one pill is missed, okay, take as soon as possible with it, okay, and take 7 day break as normal, okay. But if now you miss 2 pills in first week of the pack and unprotected intercourse has occurred, okay, in previous 7 days, then emergency contraception is also needed, okay. You should keep it in mind, okay. And if 2 pills missed in last week of pack, okay, last week of pack, okay, then a few active pills are remaining. Continue to finish active pills, start new pack without having a 7-day pill free period, okay. If it makes sense to you, Mrs. Seema, should I repeat it again for you? Yes, Ms. Seema, you need not to be worried. I'll give you written prescription as well, okay. And yes, Mrs. Seema, its efficacy is 99%, okay, but to ensure 99% efficacy, take pill on same time every day, okay. And if you miss pill, take the pill as soon as you remember, okay, and continue to take regular pill at each time, okay. Yes, Mrs. Seema, and let me remind you that if you vomit within 3 hours, okay, and then take another pill as soon as possible, okay. And let me tell you a few advantages of taking oral contraceptive pills, okay. As you have acne, so it will be also improved, okay, and your menstrual period and bleeding will also reduced, okay. And if you have any premenstrual syndrome symptoms, and they will also decrease, okay. And let me reassure you that there is no evidence of weight gain, okay. And besides that, let me reassure you that COCs reduce the risk of ovarian, bowel, and endometrial cancer as well, okay. But there are some, every drug has their advantages and disadvantages as well, okay. So let me tell you that but after taking these pills, you may have a venous thromboembolism, ischemic stroke, okay, and you'll be at the risk of having breast and cervical cancer, okay, and mood changes, okay, but no increase in depression, okay. Yes, Mrs. Seema, so there is safety netting, okay. So stop taking pills immediately if you notice any sudden severe chest pain, you become severe breathlessness, okay, and breathless, okay, and you feel pain in your cough of one leg, okay, and if you experience any tummy pain, a bad fainting attack or unexplained collapse, okay, and if you notice any jaundice, okay, or right hypochondrial region pain, okay, if your BP is on higher side, okay, if it makes sense to you, Mrs. Seema. Yes, Mrs. Seema, and besides that, you can have, nausea, vomiting, okay, and increased BP, okay. So these are the safety nettings, okay. If you experience anything, you can contact me immediately, okay, and stop medicine, okay. Yes, Mrs. Seema, you are suitable candidate for oral contraceptive pills and progesterone pills, okay, and you can also take progesterone hormone in the form of injection and implants, okay. The option of having coil in the womb is also valid for you if you want long-term contraception, okay. Here is a leaflet. It includes all the information regarding your condition, okay, and they are in much more detail than we have discussed, okay, and go home and discuss with your husband, okay, and come back in about 1 or 2 weeks time with your decision, okay. I will facilitate whatever is your decision, if it makes sense to you, Mrs. Seema. Is there anything else you would like to ask me today? All right, Mrs. Seema, take good care of yourself. Bye-bye.